Hi, we're Josh
and Ariel Wamsley,
owners of Green Valley Tree LLC, based in North Windham.
We're proud to sponsor Connecticut East this week and to serve the communities of Windham and New London counties with our tree removal and plant healthcare services.
Visit our website at greenvalleytreeworks.com for a full list of our services or give us a call on 860-234-4041. We look forward to hearing from you.
Calls to break up Eversource by elected officials in Connecticut at a PURA hearing. And what Connecticut did right and wrong with nursing homes in COVID-19 revealed in a new study. Plus, a look at other stories making the headlines from around the region. This is Connecticut East This Week. Hello, I'm Brian Scott Smith. The energy company Eversource came under attack from elected officials and Connecticut residents this week during a public hearing held by PURA, the state's public utility regulatory authority. The hearing was about rate increases by Eversource, but comments about the company's recent handling of power outages after Tropical Storm Isaias left 900,000 homes without power, some for over a week, were also raised. Joining me now is the chair of PURA, Marissa Gillette, to talk more about that meeting and what happens next. Marissa, ever so many thanks and welcome back to the podcast.
Thank you for having me again.
So a hearing earlier this week, an evidentiary hearing by PURA with Eversource, but this evidentiary hearing was to do with recent rate increases, but even so, it was still quite a sparky meeting, wasn't it?
It was a full day of both an evidentiary hearing as well as receiving comments from elected officials and members of the public. A lot of frustration and a lot of information shared.
Senator Blumenthal in particular was very to the point, almost asking for sort of like Eversource to be sort of broken down, certainly here in Connecticut. Obviously, it's a large company. What's the possibility of that, if that's something that you can even entertain at this point?
Sure, it's a great question. And since he was our first witness of the day, it was definitely an interesting note to get started on. I think I've tried to be clear in our messaging so far that from my perspective and my colleagues' perspective, everything is on the table right now. We're certainly not foreclosing any avenues of investigation. So, to the extent that we are being advocated through the proceeding to look at different ownership models, different parent companies, different structures for the electric utilities in the state. I think that's a conversation that we're going to have as part of the investigation into the storm response. I do understand that before I took over at PURA, actually several years ago, I think there was a line of inquiry from certain elected officials asked for an analysis from the Office of Legislative Research into like what it would cost to essentially buy the resources from Eversource, and I think what they got back was an analysis indicating that it would be quite expensive. So there's definitely a cost with every option. So I think it's just going to come down to looking at what we have on the table and which is going to be in the best interest of the ratepayers in the long term.
Governor Lamont was also on the call and also sort of like had his particular comments to make. He himself, of course, used to work in the telecommunications industry. Were you surprised at all by anything that he had to say?
Not at all. I think, when the governor recruited me to Connecticut, I knew that he was looking for a fresh perspective, and I think that he brings that himself. So having someone that's worked in private industry and is looking to bring that level of competition to a traditionally regulated monopoly environment is something that I would expect and appreciate from him. So his calls for PURA to move more towards performance-based regulation, I think, are being well received. It's definitely something that people can grasp. It's more understandable and relatable than the traditional cost of service regulation. And part of what I'm very interested in doing is making energy policy more accessible. So from that perspective, I embrace what he's asking us to do.
Now, during the hearing, other elected officials did actually have a bit of a pop at PURA. You have only been chair for a year or a little over a year. So obviously this is pre your arrival as chair of PURA. But basically, they made comments that said, well, PURA was responsible for overviewing these particular rates when they were presented by Eversource. What's your response to that?
I appreciate those comments because I think, for PURA to hold the utilities accountable, certainly both the elected officials as well as ratepayers need to have confidence in PURA's ability to provide appropriate oversight. So I appreciate that perspective. I think during the evidentiary portion of the hearing, there was some clarification offered that the rates that were adjusted on July 1 were not in fact voted on by PURA regulators. I think that's been there's been some miscommunication around that aspect. But to the underlying point about distribution rates and that were approved by PURA prior to my tenure, I think that's fair. It's a criticism that needs to be heard, and it's indicative of the need for additional stakeholder perspectives to be brought into the proceedings when we have the next rate case, which hasn't been filed yet, but could be coming as early as 2021. And at that time, I would really look to those same elected officials and ratepayers in the Office of Consumer Counsel and the Attorney General's office. All of those parties and perspectives need to come before PURA and present counter proposals to what the utilities are asking, because only then can PURA make a finding contrary to what the utilities are asking for, or modify the utilities' requests.
Now, the recent hearing, it was a long day of hearing, obviously evidence from many parties, Eversource in particular. Explain to us what happens now.
Sure. So Monday's hearing was on a fairly narrow issue, and that issue of the rate adjustments that went into effect originally on July 1, those rates have already been ordered to return back to the June levels. We issued that order at the end of July, and those rates should be in effect now. So until and unless PURA makes a different finding, customers can expect to see the June rates on their bills. So we've asked for additional data, and we asked for a few legal briefs from both Eversource and the other parties. That information is due to us on September 1st, and will likely require a supplemental evidentiary hearing, which has been scheduled for September 10th. So those are the immediate next steps in this docket.
And if you should have another hearing on September 10th, how soon after that, will PURA then make a decision?
We are trying to be as responsive and expeditious in what we're doing as possible, so that folks have the needed certainty. So I would hope to be able to signal next steps by the end of September, early October. That being said, the material is quite dense, and we have a lot of other things on our plate, including preparing for the storm investigations that I know everyone is equally interested in. So we'll do our best to provide some certainty about next steps in early fall.
And tell us a little bit about the storm investigation, obviously Tropical Storm Isaias. I believe you've got some public hearing dates in October.
We do. So that investigation is have a fairly broad scope into both the preparation and response by the electric utilities, both Eversource and UI. So that investigation we've also signaled our intent to consider civil penalties and reductions to the utility's allowed return if we make findings as part of that investigation that the utilities fell down in their response. So to kick that off, right now we're already in the phase of discovery, which involves issuing formal interrogatories to the utilities, along with other parties, and we're taking public comment already in writing. But the public is also going to be invited to make verbal live comments to the commissioners on October 21st, 22nd, and 23rd, and that will be followed by evidentiary hearings later this year after we've had a chance to review the public comments and the evidence that's submitted so far.
And just quickly, how do people put forward their comments if they want to put forward comments to you?
Excellent question. We definitely welcome comments in the storm docket, and they can do so by providing them in writing at any time by email to PURA, P-U-R-A, period, executive secretary at ct.gov. And you just reference docket number 200803 in the comment line, and we will accept those into the record at any time.
Well, Marissa Gillette, you've got a lot of work on your hands. We do appreciate you spending time with us and clarifying not only the recent hearing with regards to the rate increase, but also the further hearings which will happen in October. So once again, thank you for joining us on the podcast.
Thank you so much for having me back.
COVID-19 is still very much in the news, and throughout the pandemic, we've been advised about vulnerable members of our community, and in particular our seniors and those living in nursing homes or assisted living facilities. Very quickly, as the virus spread, seniors in these facilities contracted and died from the virus at an alarming rate. The state subsequently asked for a study to be undertaken to find out more about this situation, and recently an interim report was released with initial findings. We spoke with the research company Mathematica, who are headquartered in New Jersey. Patricia, ever so many thanks for joining us on the podcast. Mathematica, organization which was requested by the state of Connecticut to undertake a report into nursing homes and assisted living, part of COVID-19 sort of investigations by them. Just explain to us a little bit about what your organization does, and is this just a study, or do you also make recommendations to your client, in this case, the state of Connecticut?
So Mathematica is an independent, nonpartisan policy research and analytics firm. And what we do is apply our expertise at the intersection of data, research methods, public policy, and practice, with the goal of improving well-being for folks around the world. So we collaborate really closely with both public sector clients like the state of Connecticut and private sector partners to tackle some of the really big questions, like how best to address COVID-19 in long-term care. We use our insight and the evidence to put forward recommendations for our clients. As a company, we've been around for more than 50 years, and we've got a little bit over 1,400 folks working all over the country.
Got an interim study so far. The final report, I believe, will be towards the end of September. Do you also make recommendations to your clients about what it is that you find so that they can act on it?
So our interim report did contain a set of recommendations for the state of Connecticut, and the recommendations in the interim report were very focused on actions that the state can immediately take to better position itself to respond to a potential second wave of COVID-19. That was the focus of the recommendations in our first report. Our second report, our final report, will contain a more complete assessment of the state's response, and it will also include a series of longer-term recommendations for both the state of Connecticut as well as the long-term care industry to ensure that everyone is better prepared for future infectious disease outbreaks like COVID-19. We know that COVID-19 is the concern of the day, but nursing homes have been dealing with infectious disease outbreaks for a long time, and with the flu and MRSA and other things like that, and who knows what's down the line. So the focus of the recommendations in the final report will be kind of longer term systematic changes that can be made by both the state and the industry.
Tell us, how does Connecticut rate against other states you may have studied for COVID-19 in nursing home situations?
So in the United States, residents living in long-term care settings represent about 1% of the total population, but so far they account for over 40% of all COVID-related deaths in the country. And in Connecticut, that number is even higher, with long-term care residents currently making up about 74% of all COVID-19 deaths in Connecticut through the end of July. When we look at each state's proportion of COVID-19 deaths in long-term care, Connecticut ranks third. They have the third highest proportion of their deaths that are in long-term care. And they rank just below New Hampshire and Rhode Island, which are other states in the region. But I will note those states are much smaller and have far fewer long-term care facilities. Now, our ability to compare outcomes in Connecticut nursing homes to other states is somewhat limited by the data that other states make available. And I think, this inconsistency of data collection and reporting has proven to be one of the biggest missed opportunities for learning from the pandemic broadly. So there were a couple of states that we were able to look at in greater detail for our report, and those included Massachusetts, New Jersey, and Rhode Island. And we found that in these states, the number of COVID cases and deaths in nursing homes did not vary much once we adjusted for the size of the nursing home and when we restricted our analysis to nursing homes that were within 50 miles of Connecticut. So when we made those restrictions, we found that the number of cases and deaths in Connecticut was fairly similar to those states in the region in Massachusetts, New Jersey, and Rhode Island. And I'll just note that those outcomes were similarly bad, right? All of the Northeast was the earliest and hardest hit region of the United States when we look at the COVID data. And so that was what we found. And I would just add that, when we look at the public policy response in Connecticut compared to some other states, we found that Connecticut officials tended to follow federal guidance rather than responding to the situation, which was rapidly evolving in the state. So one of our findings was, for example, New York issued a universal masking order for all healthcare personnel on March 13th, while Connecticut, which, as you know, borders New York, did not issue similar guidance until April 3rd, which was one day after the federal coronavirus task force made a similar recommendation. There were about 3 weeks in between when those two states issued that guidance, and that's an important public policy response finding in our report.
There was a suggestion in the interim report that before COVID-19 really hit Connecticut, the Department of Public Health had only, and if my math is correct, about a third of the infection prevention staff it needed. But it did state that by July that had been rectified. Were you able to ascertain as to why there had been so little staffing before? And would that have had an impact on Connecticut's ability to deal with the nursing home situation?
So I will start by saying that the response to COVID-19 in Connecticut required a coordinated effort across many state agencies, but that the Department of Public Health was in the lead role as part of the response in long-term care. We found that one office within the Department of Public Health, which is the Office of Public Health Preparedness, had 6 of the 9 positions vacant in January 2020, which I think is what you're referring to. And those positions had been filled by July. We found that many other offices within the Department of Public Health were fully staffed over the time period we studied. And this is really an area that we're continuing to explore more in our final report. As you said, the interim report notes that these positions were filled by July, but having so many vacancies most likely did contribute to the state's ability to quickly respond to the emerging COVID-19 outbreak in long-term care facilities.
Your interim report suggests that Connecticut was slow to deal with the nursing home infections. We've just spoke briefly about potential one issue. Are you able to explain any more of the main findings or failings, behind that at all?
Connecticut officials made policy decisions and issued guidance based on the best available knowledge at the time from both national and state public health experts. That said, we found that Connecticut's earliest planning to respond to COVID-19 was focused exclusively on hospitals, and there was no planning specifically for the long-term care sector and the unique vulnerabilities of residents who live in nursing homes. We found that the state's systems for monitoring outbreaks in nursing homes were paper or fax-based, and those systems proved to be insufficient for monitoring an outbreak like the one we're seeing right now. And I would also add that Connecticut was unique in designating nursing homes as COVID recovery facilities. And these were designated nursing homes where residents who were COVID positive could go either from the hospital or from the nursing home where they live. By the time that these facilities opened in mid-April, Connecticut was largely past the peak of the first wave of COVID-19. So these facilities were really not utilized to the extent that they could have been. So we recommended in our report that the state begin planning right now to increase the capacity of these dedicated facilities so that they can be quickly deployed in the event that a second wave does begin in Connecticut.
Your interim study report said that before the pandemic, many Connecticut nursing homes had an over 60% rate of infection in the last 3 years, and that hadn't really been addressed by the state. It didn't look as if any citations had actually been issued by the state. Is there any more information you can give us about that finding?
So to place this finding in context, nursing homes are regularly inspected by the state to ensure that they are in compliance with both federal and state regulations. And these regulations include specific requirements related to infection control and prevention. We found that in Connecticut, about 68% of nursing homes had been cited by the state in the previous 3 years for deficient infection control practice. And when we compare the data in Connecticut to the country more broadly, Connecticut nursing homes were more frequently cited for deficient infection control than nursing homes in the U.S. broadly. The number 68% of Connecticut nursing homes were cited as compared to 48% of all U.S. nursing homes. And I would add that residents of nursing homes are really uniquely vulnerable to a virus like COVID. Generally, this population has more underlying clinical conditions, and they have frequent interactions with staff and other residents in a nursing home since it's a group home setting. And as I mentioned earlier, nursing homes have a history of dealing with infectious disease outbreaks like the flu or MRSA, but COVID-19 is much more transmissible. And we now know that it can be spread asymptomatically. So the normal infection control policies in nursing homes were just insufficient to respond to a virus like COVID-19.
It's well documented that the nursing home industry has, for at least for the past 30 years, had lack of standards, sometimes even care. I mean, that's why in 87, the Nursing Home Reform Act introduced to try and address some of this. My point to you is, with the issues that we're continuing to see, despite this act being put into law back in the 80s, and staff, and again, this is well documented, low paid staff, low trained staff, will you be making recommendations to the state on how it can assist or improve not only its own DPH standards, but that of the nursing home sector in Connecticut?
So you're correct that the nursing home industry is known for generally low pay, a lack of paid sick leave for their staff and training. That said, since those reforms were made in 1987, nursing homes have become some of the most highly regulated healthcare facilities in the U.S., and many of them provide very excellent care to the residents that live there. Furthermore, many of the staff that work in nursing homes choose to do so because they're passionate about caring for older adults, even though they could probably make more money working in a hospital or elsewhere. So our report found that facilities that had higher reported staffing had fewer COVID cases and deaths than did facilities with lower staffing. So clearly, staff training, staff pay, and staffing levels are a very important consideration as Connecticut considers its response to COVID-19 as well as any future outbreaks. We did make some recommendations in our interim report on this topic, including the importance of regularly testing staff to make sure that outbreaks are detected early, and changes that individual facilities should make, including assigning staff to care for the same residents consistently, which I will mention is always a good idea, but especially important during an outbreak to limit cross-contamination. And we also heard stories from staff and nursing home operators that many facilities were using hazard pay, bonuses, free meals, things like that to encourage their staff and keep up morale. For our final report, we will be considering recommendations related to systematic changes in how the long-term care industry staffs its nursing homes and the long-term care workforce. Of course, staff pay is driven by reimbursement from Medicare, Medicaid, and other payers. And I'll just note that Connecticut Medicaid covers about 70% of all nursing home care in the state. So these issues are really highly interconnected, and we do look forward to making some broad systemic recommendations as part of our final report.
Patricia Rowan from Mathematica, ever so many thanks for walking us through the interim report that you've supplied to the state of Connecticut so far. We look forward to the results of your final report at the end of September. Thank you ever so much.
Thanks for having me, Brian.
Green Valley Tree LLC is proud to sponsor Connecticut East this week. Contact Green Valley Tree LLC for all your tree removal and plant health care needs and more. Find us at greenvalleytreeworks.com or call 860-234-4041.
Time now for a look at some of the other stories making the headlines in the region recently. In the Connecticut Examiner, school reopenings across Connecticut ignore state guidance and raise issues of childcare. So the decision of nearly 100 towns to adopt a hybrid model of instruction, combining distance learning and in-class instruction, misses the role of classroom education in providing childcare for families. In the day this week, Crossound Ferry, based in New London, has applied for a permit to conduct work along the city's waterfront that includes a reconfiguration of its operations and construction of a new ferry slip to accommodate the future National Coast Guard Museum. Crossound Ferry is losing waterfront from an 11,000 square foot area that plans show will be occupied by the museum on adjacent property behind the New London train station. In the Norwich Bulletin, the president of the NAACP Norwich branch has praised the city's police department for its transparency efforts while voicing her support for a controversial redefinition of qualified immunity for sued police officers. In the Middletown Press this week, local legislators have intervened on behalf of a dozen residents of a 55 and older apartment complex on South Main Street in Middletown after they received non-renewal notices they perceived as evictions. In the Chronicle, the University of Connecticut recorded 11 more cases of COVID-19, the school announced recently, bringing its total to 33 cases since students began returning earlier this month. And the Connecticut Agriculture Experiment Station has announced a second Eastern Connecticut location that has tested positive for mosquitoes with Eastern equine encephalitis, or EEE. The mosquito was trapped at the Hampton Reservoir in Hampton, northeastern Connecticut recently. The first positive EEE mosquito was found at Stonington High School earlier in August. EEE can be transmitted through a mosquito bite and can cause neurological disease of the brain and can be fatal. In 2019, 3 people died from EEE, all of them in eastern Connecticut, 1 in East Haddam and 2 others in Old Lyme and East Lyme. That's all from us for this edition. Do send us your questions and story ideas to the show via our website at connecticut-east.com or Facebook or Twitter at Connecticut East, where you can also listen to the show again on demand. And please like, follow and share on your social media platforms too. I'm Brian Scott Smith. Thank you for listening.